Good morning and welcome to Fearless. My name is Kilene and this is a podcast about strength, resilience, and rising anyway. Today we are so fortunate. We have an amazing guest. We have Dr. Laura Franco. She is highly experienced psychotherapist with extensive clinical practice across the United States and Europe. She's the owner of Life Solution Services, and she is dedicated to providing comprehensive medical health care. Dr. Laura is a certified trauma specialist and a member of the Trauma Institute International. She has extensive experience with PTSD, and she actively collaborates with the Franciscan Center of South Tampa in facilitating their first responders post-trauma training. Look, Dr. Franco, thank you so much for joining us today. That was a lot of words to get out this morning, so I appreciate it.
Thank you for having me. Thank you.
Dr. Franco reached out when all of this was going on and just wanted to be a part of this podcast, and I appreciate it, especially with your background. Tell me a little bit about what got you into studying trauma and wanting to help families and first responders and just in general people who are going through this type of life event.
Yeah, I think a lot of people don't realize that trauma is at the base for a lot of issues. And oftentimes in therapy, people will present with, something that they believe is going on, but they don't realize that really trauma is at the source of that. There is also a lot of misdiagnosing still of, certain things where in reality we are not really checking, to see if there is a trauma history. So that's why I really, from the beginning of my career, I was so interested in also different types of trauma.
Yeah, we were talking before we came on the path I was going to go originally, and the path that I'm kind of leaning towards now is about first responders. We have been fortunate enough to be able to continue communication with some of the people who helped Katie at the very beginning of all of this. So the EMTs, all the way to the helicopter medic. But a lot of families don't get that experience, and a lot of those professionals don't get that communication and that contact. What do you think it does for those people when they're either able to see the outcome or not able to see the outcome of that trauma?
It's hard, and I do work a lot with EMTs and also policemen and policewomen, which I think they go through the same, even though in different ways. And that's one of the things that they say a lot, by the way. We were there when something major was happening, but sometimes we just don't know. I know sometimes people tell me, I will go back and ask, maybe I ask other people if they know, but a lot of times they just have no way of knowing, and that's hard for them, to manage. So
Do you think it's harder for them to see the outcome or to not know the outcome? So like if it's a bad outcome, does that hit them harder than if they just don't know what the outcome is?
Yeah, I think both are bad, but it's certainly, a profession like no others, in my opinion, because they're exposed to what we call secondary trauma, so they're not experiencing something directly. It's not really happening to them, but they're there and they're participating and they're witnessing. They cannot get away. So they're also exposed to the same. And it depends always on the person, because trauma affects people in many different ways, depending on the person. You may have two people that go exactly through the same experience, right? But they are going to respond very differently, right? But for sure, they're going to be affected.
Do you think that trauma, if they're able to get it resolved or they're able to kind of see the outcome of that, has a better effect on them? Or do you think this is still something that they will carry their entire life, and just learning how to deal with that is the best approach?
It depends, but I can tell you, and I'm not, a first responder, but my line of work, of course, I've been exposed to a lot of trauma myself, and there is no way of forgetting people and what they have gone through. So throughout your life, I still remember, people from many years ago and what they have gone through, their outcomes. So I think it's exactly the same,
Yeah.
you just don't. And in a way, yes, you're still going to be affected, particularly for them, because again, like I was saying, you know, they do a lot, you know, they are intervening most of the times, you know, in a life or death situation. They don't know what happened before. They don't know what is going to happen later on. You know, you know, is a lot, right, to go through in that moment.
Yeah, it's like they're almost just given that little snapshot of
Yes.
a whole situation.
Yes.
And then they have to go and hit another snapshot and another snapshot. Like in one shift, they could hit multiple
Yes.
bad situations. I totally get that. In your experience, though, with their healing, do you think, because I just know personally, we go through life and we're kind of like, I'm fine, I'm fine, I'm fine. Do you think that they continue to push that down until it just gets to be too much? Do you think it would be better if these services were offered to them sooner or on a more regular basis versus like when we break and then we're like totally broken and trying to put all the pieces back together?
This is something we talk about all the time, you know, services where first responders could process what happens in their line of work. They're very limited to this day, even though there is more awareness for sure that, I don't know, even like 10 years ago. So now we are talking about it much more. But in reality, the resources are still very limited. And so any program that will facilitate that is absolutely helpful. One of the programs that you were mentioning when you were reading my bio is a program that is run at the Franciscan Center, and it's called Operation Restore, and that's exactly what they do. It's almost like a little retreat where they are able to process clinically, you know, trauma that they are exposed to in their line of work, and it's an amazing, amazing program.
Is it something that is backed by local hospitals, or is that still something that you're working on, is getting out and exposing it to as many people as possible?
No, usually people are recommended by their own department, whether it's the police department or the EMTs, you know, they recommend, you know, the program, and then, you know, it's volunteer basis. So people decide to participate if they feel that they can get something out of it. I never met anybody that didn't, you know, so it's powerful.
I'm a big component of therapy and talking with people. And I feel like it's something that still to this day has taboo a little bit, I guess. Maybe it's not the right word, but people just don't feel the need or they just don't think that they need it. But I feel like everyone across the board, no matter what you've gone through, could use therapy in some shape or form. And I don't think it's something that's necessarily offered. So to kind of take a little bit of a left turn here, you know, as we were going through all of this with Katie, there were tons of services that were offered to her, but never at one point was anything offered to the family. So how do you see that it kind of affect the family as a whole? Like when one person goes through a trauma, how does that kind of affect everyone else in the wake of that trauma?
Well, I mean, I cannot even imagine, you know, the way you guys have been affected by it. There is no way that something like that cannot affect everybody in that family, because also it changes the dynamics. What you knew before is no longer there. And so now you have to adjust and manage something that is completely new. I know you guys, just following your story, you know, you guys did an amazing job. And I think you shaped and transformed a tragedy, you know, into something that has become very, very powerful. And I think that's one of the things that sometimes people do. Sometimes, you know, it could be something like that, or could be volunteering, advocating, you know, just being active, you know, so all those things are obviously very, very positive. But even with that, right, it doesn't mean that there is still a lot there, you know, that needs to be processed at one point. The other thing is the immediate time, you know, whether it's few weeks, few days, few months, like in your case, you know, right after, you know, the event. Oftentimes they're hectic, and you know this very well. There is always something, right? Something changing, right? So you have to be there, and that sometimes can lead to not necessarily avoidance, but, I have to put this on the side because I have to do that. So I cannot do this, right?
Mhm.
Um, so, my suggestion is to find a way,
Yeah.
at some point, not too late, to find a way to work on it. The other thing is people will react differently, like I was saying. So I know you have a son that is a teenager, right? Like about my son's age. So, he's gonna react very differently than you and even your husband, maybe other members of the extended family. So,
Yeah.
yeah.
That was definitely, I think, a challenge that we still face. Like Cooper definitely handled it differently, and right, wrong, or indifferent, we just kind of let him know, like, we'll meet you wherever you're at. So if you want to be a normal teenager, we'll keep that as normal as we possibly can, which was the path that he decided to take. It drives his sister crazy sometimes because he doesn't want to talk about it and dwell on it. But I think boys, especially teenage boys, are just different. And I know in time, when he's ready, he'll be ready to talk about it. So we kind of let him have that space to do that, and kind of continue to feel a little bit normal, because it did. It was like one day everything was kind of flying down the highway, then bam,
Right.
everything kind of stopped. So I do feel like siblings, especially, it can be extra hard on, just because there is that weight of, okay, my sibling is not the same. My mom
Mhm.
and dad are not as present as they used to be. And how do we all navigate that together? So, in your practice, I know you don't deal with young children. Do you deal with the parents of this? And what advice do you give them as far as how to deal with the other siblings as you're navigating through that trauma?
I think you can give your presence in many different ways. You obviously right now, as you said, we may not be as present as before, but there are many ways that you can still be there. And that's the most important thing. The other thing is to follow his lead. Right now, he wants to keep things normal. And why not? Why not? That's why he's responding to in a positive way. So I think it's important to follow that and honor that, because that's what is chosen, but you're still maintaining your presence there. You're giving him options and opportunities to talk about it, even though he doesn't want to. He may take you up on it next week, next month, in 6 months, who knows? The important thing is that you're there and you're doing that. You're giving him that opportunity.
Absolutely. When you're dealing with um, parents in general, are you finding that one parent has a harder time than the other parent? Or do you feel like both parents shoulder things differently? I know everyone handles trauma and pain differently, but how do you kind of bridge that gap between one parent may be over here and one parent may be over here, as far as how they're dealing with the situation, and kind of help them get together to continue to press forward for that child that's going through that trauma?
Yeah, it depends because, as you said, everybody responds to this differently. And one of the things that's what I noticed in my experience is everybody takes on a different role, and that's important and is necessary, right? Because obviously you have to manage a lot of things, and in a way you have to divide, how you're going to do it. The important thing, is that there is still connection emotionally. Are you able to share still? Are you able to connect and feel close despite everything, the chaos and the challenges, right? Are you still able to connect on that level? It's normal, that sometimes that is going to change too. And maybe you're not feeling that connected. That doesn't mean that it's not going to come back. You just have to be able to work for it. But like we were saying before, a lot of these dynamics, they're going to change. And in reality, you still don't know what the new ones are going to be. Is too soon,
Yep.
right? So there is a lot of adapting and adjusting to something that is very new.
let me ask you this question. So, one of the number one things that people continue to this day to say to Rob and I is take care of yourself, take care of yourself, take care of yourself. I feel like we do a pretty decent job of making sure that we take time for each other and Cooper and ourselves. But if you were to give somebody, I feel like that's just such a vague thing to say. Like,
Mhm.
what does that mean? So, if you could give somebody maybe 5 things, what does that look like to take care of yourself?
Well, what does it look like for you?
Well, quiet time at the end of the night. I think it's super important for me to, I get overstimulated super quickly. So to be able to just kind of step away from everything, put my earbuds in, maybe play a game on my phone, just kind of have that time to be quiet. Thankfully, I have a spouse who knows when to jump in and when to give me that time and kind of that quiet moment. But I feel like it's just such a vague thing that people say and they're constantly worried about it. But does it mean something different for everyone? Would be the big question, I guess.
Yeah, and you said it because again, everybody will have a different way to take care of themselves, and you said it for me is this thing, and you're doing it. So I think that's important because you're going to have different things probably, right? Like your husband will have a different way to wind down and so forth, right? Do you recognize that that's what he does in order to take care of himself? And does he recognize that the same for you? That's the important thing, right? Because otherwise it can be perceived as you're getting away. You're distancing from me, not from the situation or the day, right? You're tired, but is from me. And so I think to answer your question, as long as there is, communication and understanding about what the needs and expectations are from both, then is good, I think.
Do you feel women have a harder time with this? So I feel like more people say it to me than they do to Rob. And I think that that is just, in general, we feel like we take on more of those, like, we'll give more of ourselves and not take that time for ourselves. Is that why more people say it to women? Or is it just genetically, that's just how it works? What is the thought process behind that?
I mean, I
Or do we
think,
just not know?
right, we don't because we cannot generalize, right? There are a lot of men that will still take over and do so many things just as women do. But if you think about it, think about people that your friends, acquaintances, family, right? Who are the people that can multitask and can do a lot of things and take over a lot of the way? Probably they're women.
Yeah.
So,
I feel, and again, we're going to take another left turn here, but so in our situation, obviously, we still have mom and dad present. How do you treat differently? For instance, a dad passes away or a mom passes away, and it leaves one parent there to kind of shoulder all of that trauma for themselves and for the kids. How do you treat that differently than you would a situation where there's a child who's sick versus a parent that's sick?
I don't understand the question. Like, what do you mean exactly?
So, like when we're talking here, like taking time for myself looks different today because I have a spouse that can take over and handle the kid stuff.
Hmm.
So, if I'm by myself, so if my spouse is the one that was sick versus my child that's sick, and there's only one parent left there to kind of
Okay.
shoulder it, how does that one parent kind of take that time or handle things differently when they don't necessarily have that other spouse there to balance that out?
Yeah, that's much harder. That's much harder. Just because at that point, you know, remember we were talking about roles, right? And what is the role that you take over in this type of situation? In a situation like this is even more, right? Because now you're becoming both parents. And so even that you don't know what you're doing, right? You don't know how you're supposed to do that. So that becomes much harder. Actually, my best friend went through this just a few years ago, so I've seen it firsthand. Not even in a clinical way, but just like it's like she's like my sister. So It takes time, you know. I think there is definitely, you can adjust and you can make it happen, but it takes time. And you have to work a lot on yourself. I mean, you have to work on yourself, doesn't matter what, right? But especially in that situation, right? Because the other thing with that is you may have a lot of people around you, right? Family, friends that, you know, they're willing to help and support. But as you know, right, nobody can be like parents, right? It's a unique role that nobody can really take over, right? So it's much more complex.
And I think the confusing part of all of that comes from maybe the outside. Like, as a community, we want to be able to help in those situations, but we don't always know the right way to help. Is there a right way to help, or offering any sort of support is the right solution?
I think that depends, you know, on the person. And I think there is, you know, especially if you, for example, let's say that you have people that are closer to you, people that really know you, probably those people, they will know, you know, what is it that you need. Maybe you do need that hour every night, you know, to unwind. And so maybe if they take you dinner, right, you don't have to worry about cooking and you can do that. So to me, that will be a good way, but it really depends on the person. Some people, they do very well when they can process, when they can talk a lot. And so a phone call from a friend or a visit, right, where you can vent and talk and say whatever, right, could be very beneficial. But some people don't want to, or they're not the type of person that needs to do that. And that has to be respected too.
Yeah. Yeah. It's super hard. I feel like even just seeing our community through what we went through with Katie, it was so difficult because so many people were like, how can we help? How can we help? How can we help? And when you're going through it, you don't always know what you need when you need it. And so it was the people that were like, I'm going to come do your laundry, just put it out on the stoop, or here's dinner, or here's just a gift card to help Cooper have dinner tonight, or whatever. It was those little things that kind of helped ease that burden a little bit, even when we didn't even realize that we needed it. So I'm just thinking, as a community, how can we help people that are maybe going through situations like this? And it sounds like very similar to what we went through. Just giving of yourself or your time can sometimes be the best solution there.
Yeah, absolutely.
All right, well, we're going to just wrap this up a little bit. In your experience, do you feel that trauma can be resolved, or is it something that we continue to carry with us our whole life?
So there is a distinction between trauma and a traumatic history and PTSD, okay? Not everybody that goes through trauma will develop PTSD. And that has to do with many different things, you know, personality, history, other things, right? That they're pertinent to the person. PTSD is chronic, so it doesn't go away, but it can be managed. We have many treatment options these days. We can do so many different things, so it can be successfully managed. Trauma, when it doesn't develop in PTSD later on, absolutely, even more, right? Because at that point, it's not a chronic condition. The important thing, and there are a lot of studies about it, is sharing. And sharing doesn't mean that you need to talk about it with everybody, but finding a way of sharing helps. In fact, they did some studies after 9/11, right? Because they were expecting so many people to go to therapy because obviously it was so traumatic. And what they have seen, in a few words in that study, was that the people that reached out to get therapy were the people that didn't have somebody to go home at night. So when that happened, they didn't have anybody really to talk about it. But most of the people that could do that night, they were okay. I mean, they were not okay, obviously, because of the magnitude of what happened, but they did not need to seek further help.
Yeah.
So my point is finding a way to share, finding a way to be active. A lot of the things that you're doing, I love, because to me, they help you process what happened. They help you help other people that may have going through this, or may have gone through the same, or maybe they are going through the same.
Yeah.
And that's, to me, is incredible.
Yeah.
And I'm sure it
Well,
helps.
it helps us, and I think it helps other people too to be able to see that they're not alone, that there's other people going through it as well as them. I'm not saying that we are perfect in any stretch of the imagination. We are not. We have our hard moments like anyone else, but just being able to share it and open ourselves up to that has allowed us to find a good path and like see light at the end of the tunnel, because it opened us up to, here are other people that are further along than you, and then there are people who are further behind us, that we can kind of be that light for, as those families were lights for us to kind of show us what that is. And I feel like the difference, and this is a good question for you, positivity, I feel like has been such a huge part of this journey for us. Maybe not for everybody. Rob thought I was being a little naive at the beginning, and maybe so, and maybe that's just my personality, but being able to look at every single positive thing as this chaos was going on around us, to be able to pick out those few little things that she was doing or little steps that she was taking really helped to keep us going forward. Do you feel like positivity plays a role in that? And people who can kind of see that versus people who have a harder time looking at that?
Yeah, because in the end, is your attitude, right? It is whatever pushes you forward, right? But if you stay still, nothing good is going to happen, right? So
Yeah.
no, absolutely. Positivity in any situation, I think, will help. Not hard, no, I mean, not easy to find sometimes, to find a way to be positive though. So, if you are able to find even something small, it will help for sure. And it will help in that movement. That's one of the things that even in counseling and therapy, we always look for movement, right? You're not still, you're not stuck, but you're moving, even if it takes so much and it's going to be long, right? But there is still movement. That's the most important thing. And in a way, you cannot do that without positivity. You have to believe, right? You have to trust that something good is going to come out of it.
Even if it's a small step in the right direction, every
Yes,
day look for something, right?
yes, absolutely. Absolutely.
Well, Dr. Franco, if people want to get a hold of you, what is the best way that they can learn more about you, your practice, and the amazing things that, I mean, I only read like this much of your bio. You do a lot. So how can they find you? How can they learn more about you and communicate with you if they need your services?
Yeah, I mean, we are in Brandon. Our office is by the hospital on Oakfield. The website is lifesolutionservices.com. Probably we can put it somewhere in
Yep.
the. Yeah, we do. I have a team of 10 clinicians, so everybody has different specialties. We are pretty known in the community because we have been in the community for many years. We do different things. One thing I wanted to mention, since we have been talking about first responders, is that we are offering a free retreat for first responders in April. And maybe I can send you the information so it can be posted, because
I should do that episode for sure.
thank you. It's a population that I care a lot about, and so we want to offer something to them. So we're gonna do it April 18th in Tampa. It's gonna be a one-day wellness retreat.
Wonderful. I think that is fantastic. We cannot say enough about our first responders and how they have impacted our lives and Katie's lives. And probably the reason that she's still with us is how quickly all of them move. So I appreciate that. And we will definitely post that and get that out for everyone. And I just want to say thank you for coming on and being part of this. I didn't even realize that we had connections until we met up today. So now we get to talk a lot more. I know it's a small world, it's a small community, but I appreciate it. Thank you so much for giving of your time and your information. And if you guys need any services, definitely reach out to Dr. Franco and her staff. They would be more than happy to help. And I appreciate you being here today.
Thank you. It was my pleasure. Thank you so much.
Have a great one.
You too.
You too.